Okay, we've done a lot of Asyra testing with a great variety of different conditions. And I've asked Randy, who's one of my patients, to just describe what he went through in his past and tell us where he's come under treatment. He's treated with chiropractic, acupuncture, applied kinesiology, and now with the Asyra. Randy, just tell us your story.
Okay. When I first met Dr. Cliff, I was in pretty bad physical shape. I had a lot of intestinal problems, a lot of colon problems, and I've been seeing Dr. Cliff for quite some time now, and he's really helped me tremendously. There are many things he helped me with. In the very beginning, the early stages, there was a lot of chiropractic work, and from there, which really helped me a lot, helped me my whole, physicality, and actually emotionally too, as far as trying to help myself and having a lot of confidence in Dr. Cliff.
A biggie with you in the beginning was getting you back into a normal lifestyle. You're out on disability, right, and due to numerous different conditions, and probably the biggie was getting out and playing basketball again.
Yeah, that was very helpful. Yeah, and plus, to enjoy something to do adds a lot to it. But yeah, I was in the type of shape where I was barely walking. Actually, I was a total mess. And now I'm absolutely much improved, and continuously, improving.
Yeah. So you're getting your life back again, your social life, and your sports life is there again. His colon problems go way back, and they're very, very severe. Currently, you're almost normal. Utilizing the Asyra, basically I put in the basic information that's needed, and we pick some parameters. And in this particular case, I'm going to run a very simple test, and this one will be hormonal profile. Randy's holding the electrodes. The unit will go through and initialize. It's testing 20 different systems: the adrenal glands, the appendix, arteries, bladder resonance, central nervous system, colon, connective tissue, eustachian tube resonance, eye resonance, frontal sinuses, gallbladder, heart resonance, hypothalamic gland resonance, joint resonance, kidney resonance, large intestine resonance, liver resonance, and the list goes on. What it determines is based upon electronic signatures in the body, if there's abnormal signatures where the tissue isn't reacting the way it should be to the normal stressors in life. Okay? When it finds a particular system that's out of balance, it then goes in and sends in a series of homeopathic remedies or electronic signatures on a photon level, and when it creates a photonic resonance, that means that the remedy will clear the particular issue that's present. Okay? Right now, under the hormonal profile, it's showing a red area, which is something that is more acutely inflamed or a new condition, and the balancing item being DHEA. Okay? DHEA is the building blocks to all of the body's steroids and hormones. The treatment parameters that it comes together is that you'll take 6 drops of a liquid remedy for 3 weeks, and that will clear this particular issue from the body. At the same time, it also shows aldosterone levels that are off, and aldosterone levels basically helps to facilitate potassium exchange for sodium in the kidneys. Melatonin is the third item, and melatonin regulates the circadian cycle, or particularly helping with sleep. So if melatonin levels aren't normal, you might have difficulty sleeping. Do you have issues with sleeping?
I do, sort of.
You do?
Yeah,
okay.
I really do.
And have you seen a big change in the past month? A little change?
A definite
big change. Okay.
A definite change.
Right. So this is showing is that there's still an issue there, and it's a yellow marking, and yellow markings mean that it's a chronic degenerative condition. Now, this has been going on for many years. From this point, with these particular 3 remedies, I can go and I could print out a report which would specifically tell you what's going on, which I've done in the past, or we can make a remedy. The remedies are made on the test plate right over here, and at the same time we can also test for different nutritional supplements. Okay, so for the adrenal gland, we can put the adrenal support on here, and I can go to the test plate and test it, and we'll see what the response is. And the response comes back that that you do need it, or it will be beneficial for you. And now it tests to see the quantity that you're going to take. And the end result is 3 capsules a day, which would be 2 in the morning, 1 in the evening. Okay. The adrenal glands are where the DHEA comes together to form all of your other hormones. The other profile we did was for a liver cleanse, so I'm going to just check and see whether a liver support is beneficial or not. And it is. And that comes up saying 3 capsules a day. So the end result is not only does it give the homeopathic remedy that will strengthen your body, but at the same time, it also can tell us what nutritional supplements need to be taken. Okay, using the laser, and this is a handheld laser, which is in a nice green format. We put this laser onto the test plate, and we will make a laser remedy. And so the liquid remedies we make put the frequencies, the homeopathic frequencies into the body that will help to normalize this particular system. So if I did a comprehensive profile, we may be running 50,000 different energetic tests. From it, the first time we ran it, it came up with 81 different remedies that would help to resolve it. We then put into the laser the 81 remedies, and at the same time now we'll make a liquid remedy in much the same way. And the liquid remedy you can take on a daily basis. So as I said before, the liquid remedy has all of the frequencies needed to normalize your system. The laser is a detoxification remedy which actually goes in like a particulate form. So this is treating you from the outside in. The liquid remedy treats you from the inside out. And the test results are instantaneous, as we found out in the past. So initially I would muscle test. We found that you had very poor balance when you're standing on one foot. We found that you were weak to electromagnetic fields, and a strong indicator muscle went weak. And as soon as we lasered you, or had you hold the liquid remedy, you instantly became strong and you could stand on one foot. Good. And we treat all of the auricular points in the ear simultaneously. Good.